Whitmer told us at 6 o'clock this evening Medicaid figured he earned $27 too much per month. Tonight, WHAS 11's Joe Arnold reports on the effort to get Whitmer the medical care he needs.
My headaches have gotten pretty bad.
In December, 9 months after he was given 1 year or 2 to live, Medicaid dropped Chris Whitmer.
Entirely, just set adrift.
Medicaid had paid for his pacemaker defibrillator, but when Chris's Social Security Disability kicked in, he says it paid him $27 too much per month to qualify for Medicaid. Now he's trying to hang on long enough for Medicare.
2-year wait for Medicare. And you don't have 2 years. I mean, I don't mean to be...
It would be amazing.
You're absolutely right.
You know.
I would be quite surprised. I'm 2 months into this now, and without any coverage, and I'm on the decline.
A cardiologist has agreed to see Chris in his office, but without the Medicaid coverage and the Medicaid card, Chris is still not getting the coverage he needs to save his life.
Let's figure a way to reconnect it without opening up. How about that?
It's Chris's second free appointment at Bluegrass Cardiology.
You feel a little bit of fluttering. That's good. That's what I want you to feel.
He senses that his pacemaker is not working properly.
To have the complete confirmation on that, you would need the x-ray.
But this practice doesn't have an x-ray.
What we do is we just zoom in, show the bottom of the heart up close.
They try to see what they
You
can
can actually see the blood swirling around in there.
with an echocardiogram.
You know, he's walking around crashing into stuff, trying to keep him steady.
Yeah, she found me on the ground last night in our bedroom. So
Dr. Shankar Shadramani says with a special pacemaker, Chris's heart has gotten stronger. He hopes to improve Chris's quality of life and extend his life 5 to 10 years.
But again, no stopping medication. If you don't have it, let us know. We can substitute or we can do something about it.
Chandramani is also trying to arrange other free services, medical attention, one elusive Medicaid card away.
That kind of a system is just not right, and I don't think that that is fair to him.
with any bit of luck, we'll get some good news out of this.
If anyone deserves a little bit of luck,
I'm hopeful.
it's the Whitmers. In 1992, Hurricane Andrew wiped them out. Their daughter is diagnosed with autism, and Harriet suffers from Crohn's disease.
You tend to quit living, planning ahead, and living the day for the moment because there may not be a tomorrow.
Kentucky's Cabinet for Health and Family Services says the rules are in place to protect the most vulnerable. And if they would make exceptions, that's essentially fraud. So is there a legal way? I sought out Louisville's leading Medicaid attorney.
It's an unwieldy giant labyrinth of regulations and rules that goes back about 40 years.
Brian Bareilles normally helps families of senior citizens avoid financial disaster when they're faced with nursing home care. But he's never quite seen a case like this.
He's not out to protect assets, as you said. He's out to try to protect his life. And I would have to think somewhere with some advocacy and to make a real push on this, that somebody's going to find a way to make this come together for him.
Bareilles says Chris may be able to qualify for Medicaid if he can qualify first for in-home nursing care. Meanwhile, the Whitmers have just been disqualified for food stamps.
This is the first month that we'll have to. February.
And what was the reason for that? What was their explanation?
We make too much money. We're too wealthy, I guess.
From Social Security Disability.
Yeah, exactly.
There you go. In a nutshell, that's how the system works.
Chris Whitmer doesn't have the strength to get out of bed some days. An entire month will go by without him leaving their mobile home. He is desperate.
I feel like my life could be lost for no reason at all. I have a family. I don't particularly want to die, not when it's avoidable, when it's treatable.
Joe Arnold, WHAS 11 News.
And the Whitmers have applied for help with Chris's prescription drugs through a program with the pharmaceutical companies. They are waiting to hear back on that. Meanwhile, Joe Arnold has contacted the United Way for their help. And since our 6 p.m. story, others may also be stepping forward, and we're going to keep you posted on that.
From the top athletic